I had xrays and my dentist said there is a shadow above the tooth in the gum area. The tooth had a root canal done 38 years ago and the tooth has a cap or crown on it. I have pain in the tooth. What does all this mean?
Hello, I'm Mark Bornfeld, DDS. Welcome, and thank you for putting your trust in me. Although there are several speculative explanations, the obvious and most logical conclusion under the circumstances you have described is that the previous root canal has failed, and the infection it was intended to treat has either resumed, or never really went away. The shadow to which you refer represents an absence of bone at the tooth's root tip. Normally, bone surrounds the entire root, and an absence of bone implies that the bone is being destroyed by an active process of infection. Although that infection may be chronic and at a low level of severity, it can cause significant bone loss over a span of 38 years. I infer from the fact that your dentist is referring you to an oral surgeon that he is contemplating either an attempt to salvage the tooth in a procedure known as a picoectomy. This can sometimes eliminate infection without the need to disturb the crown, and allow your tooth to continue serving its function. Hope this helps.
When I called to make the appointment with the oral surgeon, the nurse said they will do a biopsy. How is that done?
The precise method used will depend on exactly what plans your dentist, your oral surgeon, and you have for that tooth. For example, if the previously described picoectomy is performed, some tissue will be saved in the course of cleaning the root tip. This area is directly accessed through an incision in the gum. Alternatively, if it is decided that the tooth should be removed, this tissue specimen will be taken from the tooth socket after the tooth is extracted. The specimen is then sent to a pathologist, who will look at it under a microscope to conclusively identify the type of tissue present. Don't get too concerned about the intent of the dentist in recommending a biopsy. It is customary to examine all abnormal tissue taken from these teeth, even if there is little expectation that it will be nothing more than chronic infection. In the context of an old root canal, there is little else that it could be, and either a picoectomy or extraction would be curative. Hope this helps.
So if they take the cap or crown out, would they have to pull the post which is made from my tooth with the root canal? If they pull that post, then there is no way to put the cap back on? This tooth is on my right next to my too big from teeth. I think it's called a canine. What do they then do with the empty place when my tooth was?
No, there would be no reason to remove either the crown or the post unless there is some intent to retreat the root canal, and that doesn't seem to be the case, because an oral surgeon does not provide root canal service. This would be done either through an incision in the gum adjacent to the tooth in the case of a picoectomy, or through the extraction socket if it is decided that the tooth should be removed. If it is decided that the tooth must be removed, it would presumably be replaced by some type of prosthetic device, i.e., either an implant, a traditional fixed bridge, or a removable partial denture. Hope this helps.
Around the gum line of this tooth it is black and there is an indentation above that. I have pain in the tooth that has been like this for years. I just thought that was normal for the cap. If there is an infection, would I just take oral antibiotics? If it's not an infection, what would be worst case that it could be? I would like to know all possibilities. Thank you for spending so much time with me. I really appreciate all the information you have given me.
No pain around a cap is not normal. As for antibiotics, they would at most play a supportive role in the treatment of your infection. They would not serve as a sole therapy, because the infection would reassert itself as soon as the antibiotic was withdrawn. Cure of this type of infection requires either root canal retreatment, a picoectomy, or tooth extraction. This is not a matter of a worst case. A dark area on an X-ray at the tip of an endodontically treated tooth is a chronic infection, and any of the three previously mentioned treatment approaches, depending on their respective feasibilities, would be sufficient to eliminate the infection. This is not a malignancy or other lesion with serious health implications, it is simply a chronic dental infection that should be treated. Hope this helps.
Thank you so much, Dr. Bornfeld. You have given me information that has helped me understand what is going on with my tooth and really made me feel better about this ordeal. Thank you. Kathy.
You're welcome. Good luck.
If you have a health question and want to chat with a doctor now, visit justanswer.com/ythealth.